Georgia Academy of Chiropractors. I'm joined with my partner, Sarah Benader, and our colleague, Zeke Van Kuren, both attorneys in our Atlanta office. We're going to be talking with you today about legal planning during this coronavirus pandemic. We've got a couple of major, I guess several major categories of information to go through with you today. And so we want to get through our prepared materials as best we can. But most importantly, we want to leave this opportunity for y'all over the next hour to answer questions related to legal issues that have been raised by the virus, and help you as best we can address those legal issues. And ideally, it's one of the reasons we put planning in the title, help you plan or start planning to reopen. I want to thank our sponsors today, and in particular, Dr. Hayden for providing the Zoom link for us. So Dr. Hayden, we're going to get started with the slides, and I'll start moving them through. Zeke and Sarah are both going to have various portions of the presentation where they'll be speaking at length. And so is it possible, if you do the mute everyone function you were talking about, can they unmute their microphones at the time they're ready to speak?
Yes.
Great. In that case, we'll get started. All right, so a couple of late-breaking developments this morning. As I mentioned, we're going to be talking about several issues, but we wanted to first give you some news from the state of Georgia that happened last night or late yesterday afternoon, if you haven't already heard. We'll be talking about Senate approval of additional PPP funding that just occurred this morning, and then more generally talk about three main categories. The first is telemedicine and HIPAA. The second is the Families First Act that deals with emergency FMLA as well as emergency sick pay leave. And then the CARES Act, which led to these payroll protection, paycheck protection loans and the PPP program we've been discussing really for the last couple of weeks as a country. So let me move on to our next slide. This is hot off the presses because it just happened this morning. The Senate has been stuck on discussion of specific dollar amounts with regard to what the fourth version of the stimulus bill is going to be. And so as of this morning, Senate Minority Leader Chuck Schumer from New York had a press conference and announced that there is agreement between congressional Democrats and the Trump administration about what that's supposed to look like. So notice on the middle bullet, ultimately that means $310 billion in another program, just like the CARES Act, should be flowing in the next couple of weeks. I think in terms of planning purposes, our advice to y'all is, if you have filed an application and either haven't heard, like so many American businesses haven't heard back from your bank, or have been approved and not yet funded, or if you've applied and gotten rejected by your bank because they're out of money, we encourage you to refile that application, or at least reach out to the bank today and say, I understand that Congress has approved $310 billion more, and we want to get in line for that. I think that would be a good use of your time this afternoon or tomorrow. In addition, Governor Kemp issued another emergency order last night, which led to cheers, at least in the Sanders house, for the teenagers who are pent up here and ready to go out and do something, that there'll be staggered reopening of businesses, including gyms and other kinds of workout facilities this Friday, and then restaurants next Monday. The first paragraph of the governor's order, though, applies directly to y'all. And in that, he said, if you are in any kind of healthcare business, most hospitals have remained open, but many chiropractic offices have either reduced their hours or shut down. The governor's emergency order from last night encourages every healthcare business to get back to normal while observing specific and frankly strict sanitizing and social distancing operations. We'll talk about that more in detail at the end of our time together, but I just wanted to get that out, kind of late breaking news at the outset, that at least for healthcare and at least for government policy in the state of Georgia, the government wants us to return to business as usual as soon as possible. So about a month ago, the Department of Health and Human Services Office for Civil Rights announced a HIPAA and telemedicine waiver. The significance of that for Georgia chiropractic practices is simply that unlike past years and prior to March of 2020, where you may have had to have specialized technology or specialized equipment in order to comply with the HIPAA security rule, you can now use direct face-to-face communication with your patients like FaceTime or Skype for telemedicine visits. As you see here on the next slide, though, that's not all the story. About 3 weeks later, so I guess now a week and a half ago, CMS issued additional waivers on telemedicine, and that's where Zeke's going to take it over. Zeke, take it away.
Just with those additional waivers that CMS issued a week and a half ago, it expanded the provision of telemedicine services.
I have no idea. Sorry.
The waivers are limited exclusively to Medicare beneficiaries. And so just for clarification purposes, wanted to make sure that people were aware that even though a lot of these waivers are out there, once you start looking at them more carefully, the scope of them are much more narrow than what some of the headlines are implying. So for the CMS telemedicine waiver, in order for a provider to participate, they must be enrolled in Medicare, have a valid license in whatever state they're practicing, and they're furnishing services in the state during a public health emergency. And so that's ongoing nationwide now. And then it can't be excluded from practice in whatever state of residence or an out-of-state location. So next slide. Okay, again, the big thing to remember with these waivers in terms of telemedicine is that it's coming from CMS, which regulates Medicare beneficiaries. And then you have to also look down at licensure requirements to see what is specifically said by the Georgia Board of Chiropractic examiners. And so when you look to guidance from them, they haven't published any sort of information one way or another regarding telemedicine or CMS waivers or scope of practice involving telemedicine, which leaves it, lots of gray area at the moment when it comes to telemedicine for chiropractors. Okay, next slide. Okay, one of the big changes with the CMS waiver is that previously, in order for there to be any sort of Medicare coverage, the beneficiary would have to be located at certain originating sites, either in a medical facility or some sort of rural area. But now with the waiver, telemedicine services provided to Medicare beneficiaries.
But if I plug this in, this isn't working.
Enrolled, located anywhere. So that means the beneficiary could be located in their home, in any sort of setting, in order for the provision of those services.
Come on now.
Okay, next slide.
Let me just, before we move on to the next slide, mention everybody. Dr. Hayden has muted the lines and or at least has tried to mute the lines from his control panel. We are hearing some background noise and a little conversation from some of the attendees. So if you have not already done so, please look in the lower left-hand corner of your screen. There should be a little microphone there that when you click on, gets a red line across it horizontally. That'll help everybody hear what Zeke is saying about telemedicine waivers. Thank you. All right, Zeke, slide 8.
The next big change with the CMS waiver for telemedicine is previously telemedicine services could only be provided to Medicare beneficiaries if the provider had a previous relationship and had seen the patient within the previous 3-year period. And that's no longer the case, where services can be rendered now to new patients. But as I said earlier, you want to see what specific requirements are in place by the licensure board, and that guidance is ideally forthcoming to provide clarification on their position with that. Okay.
It would be lovely.
Next slide. The other thing to note is with these waivers, there was scope of services, or where services can be provided and the type of patients that it can be provided to, has been greatly expanded. But what Medicare will actually reimburse for still remains somewhat unclear, where it's our understanding that for chiropractic services, reimbursement is very limited for Medicare beneficiaries. And so with the new telehealth CPT codes, we would just refer you guys to speak with a billing specialist to see what sort of strategies may be in play there. Okay.
Okay, I think this is a good point to stop, Dr. Hayden, and see if anybody has any questions about telemedicine, HIPAA waivers, or the governor's order last night. As we switch gears into Families First Act and start talking about emergency FMLA, those kind of telemedicine questions may not make as much sense. So let's pause here and see if anybody has any questions.
Sure to unmute yourself before you ask.
Okay, with no questions, we'll move on to our discussion of the Families First Act. This is a law passed by Congress and signed by the president in late March and became effective April 1st. And as so many of our clients have asked us over the last 3 weeks, led to a lot of questions and confusion about how to handle employees who are requesting leave because of the virus, either because they're potentially sick with it or because they have to stay home and take care of kids. Whose daycare centers or schools may have been closed because of the virus. So it's led to a lot of concern and some controversy. I'm going to hand this off to my partner, Sarah, who's an expert in this area, to walk us through these slides, and then we'll open up for your specific questions about these areas in a few minutes. Sarah?
Thanks, Rich. So the Families First Coronavirus Response Act was signed into law on March 18th. It became effective April 1st. There was a grace period of implementation for the first half of April, but we're past that period now. And the Families First Act will remain in effect until the end of 2020. There are two key components of the Families First Act. The first is the emergency FMLA leave. So it's an expansion of the previously existing FMLA leave. And the second is a new type of paid leave. It's the Emergency Paid Sick Leave Act. The emergency FMLA leave portion requires employers with fewer than 500 employees to provide paid family leave. So this is a change from traditional FMLA. The leave is required to be paid to employees who've worked with that employer for 30 or more days and need to take leave. They're either unable to work or unable to telework due to childcare needs that have been triggered by COVID-19. The Emergency Paid Sick Leave Act, and we'll go into more detail for both programs, makes employees, all employees, regardless of how long they've been working with the employer, regardless of